Good morning. Welcome to the CDPH HAI program training for hospital HAI data validation. My name is Sheila Segura, and today we will be reviewing the step-by-step process to complete 2024 internal validation. Next slide. First, I would like to thank all facilities that participated in our 2023 internal validation exercise. You can visit our validation webpage and see a list of participants for both 2023 and 2022 internal validation. We appreciate your participation and hope it was a valuable experience for everyone. Next slide. I would also like to briefly touch on external validation. External validation begins September 16th, 2024 this year, immediately after internal validation is complete. Invitations will be sent to participants who have not participated in external validation in either 2022 or 2023, in addition to 10 randomly selected facilities who have previously participated in external validation in one of the previous years. Data for external validation will review Q1 and Q2 HAI events for 2024. However, for internal validation, we will only be reviewing Q1 of 2024. Next slide, please. So let's go ahead and start internal data validation. Next slide. The objectives for today are the elements necessary for completeness of case finding, including location mapping. We will be identifying the steps involved in conducting CDPH HAI internal validation process, demonstrate how the validation workbook can be utilized to complete the validation process, as it includes our forms and instructions from start to finish, and we will review the process for submitting the summary of findings as well. Next slide. We have some changes to 2024 validation process. What is new is we have added ASA score to the denominator data review. We have added Fusion to SSI validation, including new flag codes for Fusion review. We have removed BMI from denominator data and removed HPRO from SSI validation. Next slide. Here we have the validation timeline and the web page. You can click on this link and get to our web page and see timeline and our other resources available. It officially begins July 1st, 2024, and on September 23rd is the deadline for submission of your findings. We would also ask for everybody who does identify missed events to enter them upon finding them into NHSN, but if you have to submit any, please submit them by September 15th. And this also shows September 16th, where external validation begins. Next slide. Now I'm going to go ahead and pass it over to my colleague, Chris, to review mapping for you. Thank you.
Thank you, Sheila. Good morning, everyone, or afternoon, whatever time in which you're listening to this recording. I'm going to briefly cover patient care location mapping. So please use the NHSN Patient Safety Component Manual instructions to determine the appropriate CDC location code. So it's imperative to use the correct locations, as incorrect locations affect the validity of the NHSN database, the facility-based standardized infection ratios, or SIRs, interfacility comparisons, and lastly, state validations. For each BSI and lab ID event reviewed, determine the location of attribution has been appropriately mapped in NHSN. For example, an ICU that is 55% medical and 45% surgical, the correct CDC location code would be medical/surgical critical care. The justification is this specific scenario meets the 80% rule for critical care acuity level and does not meet the 60% rule for designation as either being solely a medical or surgical service level alone. Therefore, you must use the combined medical/surgical designation. Next slide, please. Ensure locations with an active status in NHSN are truly those that are operational units within your facility and reflected on the reporting plan. To review your active locations, go down to the drop-down status box and select active. Click Find, and a list of all your active locations will populate. Next slide, please. You also want to check the last column if you validated that the locations where each event occurred is accurately mapped in NHSN. Next slide. Now I'm going to pass it over to my colleague Zenith, who will cover validating CLABSI events.
Thank you, Chris. Yes. So when we're validating CLABSI events, we first want to start with a line list. So what you want to do is go straight to your laboratory and get a printout of all of the positive blood cultures for whatever quarter you are going to be validating. And you don't want to use any type of data mining or any type of filtering from your EMR. You actually want to get the line list directly from lab. And then you would want to sort your line list of positive blood cultures by patient. And then if the cultures are taken multiple days in a row and would be reported as the same infection, then that counts as one event. And then if a patient has had a positive blood culture and only one bottle is positive, that also counts as an event. So then what you want to do is number all of your events and then randomly select 20 to review. This exercise will require that you review 20 positive blood cultures as a random sampling from your positive blood cultures. So then you want to enter those events to the corresponding numbers on your CLABSI validation form 1, which we will show you in a little bit. Next slide, please. So here would be a sample of your blood culture line list. And as you can see, it's sorted by name. And it's actually helpful also if you sort it by location, because then you'll have the positive blood cultures for each patient and the location that they were in. And then you can obviously get the line list for whichever quarter you're doing your validation for. Next slide, please. So then if you're looking at the sample blood culture line list, you can see that the episodes, you number the episodes for each person that has a positive blood culture. Most facilities will have about 200 positive blood cultures. So from that list of 200, we ask that you randomly select 20 events. And then you can see that sometimes the same patient will have two separate positive blood cultures within the time frame that were drawn at different dates. Next slide, please. So here's that form that I was mentioning earlier. This is our CLABSI validation form 1. So here you can see we have the 20 validation events. So you'll start with the first column, which is the date of the first positive blood culture of your BSI event. Then you put in the admit date, the hospital unit where the specimen was collected. And then question 1 is, was the event reported to NHSN as a CLABSI? So if it's yes, then you put in the corresponding NHSN event number. And if not, then you select the no. Then you select it. So if you've answered no for question 1, then you complete the next series of questions, which is no central line was present within 2 days, or the line wasn't in place at the day of the event or the previous day, or it was present on admission and not discharged in the previous 2 days in terms of the patient, or it's a contaminant like a skin contaminant or a skin commensal, right? So there's a single positive blood culture or 2 positive blood cultures within 2 days, but no signs and symptoms. So you mark the corresponding box if those apply. Or it can be a secondary BSI with a primary source of infection that was identified, or it did meet CLABSI exclusion criteria. And then the last box, if you've answered no for question 1, is that it was missed, that it should have been reported as a CLABSI, but it was unfortunately not reported as CLABSI. So then you would check that box. And then if in question 1, your answer is yes, that it was a CLABSI event, but was reported in error So after your review, it was not a CLABSI, then you would check that box. And then if in question 1 your answer was yes, but the event was reported correctly, then you check that box. And then the last box is that the unit where the event occurred was appropriately mapped in NHSN. You check that box. So then at the bottom, we have the totals. So column A would be the totals that should have been reported into NHSN, but were not reported. So that would count as number that was missed. Column B would be the total that should have been reported and was correctly reported into NHSN. That's your column B. And then the last column is that the unit where the event occurred was accurately mapped in NHSN. So that's your column D. So that is how you fill out Form 1 for CLABSI. Next, I'm going to turn it over to Deweese to talk about MRSA validation.
Thank you, Zena. As you are preparing for your MRSA Lab ID validation, we want you to use the line list that you previously used for your CLABSI validation, because this is your raw data of all of the positive blood cultures that your facility collected during the validation period from January to March 2024. The difference is we would like you to sort these by patient name or MRN and number them individually, not in clusters like a BSI event. So you will refer to the NHSN line list of MRSA BSI events reported to your hospital for the 3-month period as well to prepare all of the MRSA Lab ID events that you reported during this time period. Now, out of your raw data, we'd like you to select 20 patients to review. If your total number of positive MRSA blood cultures was less than 20, you'll use all of those and plug them into the form 2. So you would just number them 1 through whatever your total is. If the number of positive MRSA blood cultures is greater than 20, divide the total by 20, and then select every number that you got out of that calculation. So, for example, if you have 80 positive MRSA blood cultures, you would divide by 20. That gives you 4. So every 4th positive blood culture would be selected. And you would plug those in and number them 1 through 20 onto Form 2. Just to clarify, you would sort your previous raw data list from CLABSI. You will sort that down to be only the MRSA positives. Next slide, please. So you'll enter each positive blood culture into the MRSA BSI validation Form 2. So you'll enter the lab list number, the numbers that you created, then the specimen collection date, the date they were admitted, and the hospital unit where the specimen was collected. You will also take an opportunity to ensure that you have accurately mapped that location. This is your opportunity to take a double look at the mapping. Next slide, please. So then you'll review each patient's medical record to verify your decision on whether or not they were reported into NHSN. So you have a column for the NHSN event number, if they were reported into NHSN, and or you would just check no. There is where you can indicate if they were not reported into NHSN, reasons why. You will check possibly if it was a duplicate or missed and should have been reported. Next slide. And then for each MRSA positive blood culture that was reported into NHSN as a lab ID, verify that the case met inpatient lab ID criteria, and which is again just a double check of what you've already reported, and then determine if the case was reported correctly or if it was reported in error. And then you will keep this information and have it available for a summary of findings. Next slide, please. Now we're going to move into CDI validation. Next slide. So you'll begin to see a pattern here. So we're preparing your line list from your lab. So you want to reach out to your laboratory and ask for the raw data of all of the final positive C. diff lab results. So depending on what your what your testing strategy is, whatever the final test result is, if you're using a multi-step testing approach, you will make sure that you have all of those in your raw data and consider it your final result for those in the final step. And this is for all of the patients. The specimens were collected in the inpatient units or the ED locations from January 1st to March 31st. You want to make sure the list includes the name, MRN, date of specimen collection, patient location at the time of collection, and date of admission. Sort your list by the name or MRN, and then number them randomly. Select 20 patients to review. Just the way you did it with the MRSA lab ID events. If you have less than 20, you'll just plug those in. If you have greater than 20, you'll divide by 20 and then fill in the 20 selected for review. Make sure that you refer to the validation workbook, page 10, which will guide you through completing Form 3. Next slide. So here is Form 3 for CDI validation. And this shows how you will list out your C. diff lab numbers there, 1 through 20, the positive C. diff specimen date of collection, your admit date, and the unit where the specimen was collected. Then you'll review your NHSN line list and check yes and include the NHSN event number if the specimen was reported to NHSN as a lab ID event, or check no if it was not reported as a lab ID event. Then you'll answer question 1. If you did not report them to NHSN, we'd like to know if it was a duplicate or missed and should have been reported. If, question 1 answer was yes, but event was reported in error, complete this section that it was reported in error and does not actually meet lab ID criteria per NHSN. Please check this, the box here if it was reported correctly, that you have verified by reviewing the medical record, and that it was reported to NHSN, and yes, it was reported correctly. And then also verify in the final box that you have double-checked your mapping for the unit of attribution, that it is mapped correctly in NHSN. Next slide. Now I'm going to hand it over to Maggie to discuss SSI validation.
Thank you, Deweese. For SSI validation, again, to reiterate, we are doing just Q1 for internal validation. So if you're wondering, external versus internal, that's the difference. For internal validation, we're doing Q1. So for SSI validation, we're going to identify all patients who had 2 inpatient procedures. These are colo and fusion, and that's performed in the first quarter of 2024, so January 1st through March 31st. So do a look back using your hospital billing data and find those patients that have an NHSN-defined ICD-9 surgical procedure code. And you can find this by uploading the Excel spreadsheet, and we have the link here. It's also going to be in our toolkit. So save these procedure lists for your reference and make sure that every procedure identified has been reported to NHSN. Next slide. So your billing or medical records office needs to query the billing data and looking for diagnostic flag codes during the index surgical admission and any admission up to it's 40 days after the surgical procedure for colon surgery. Now, keep in mind this year was a leap year. So if you're looking at a surgery that occurred and you're counting 40 days, make sure that you count 29 days for February. So this would include a review up to May 10th of this year if the surgery was performed on the final day of the first quarter. So they had surgery on March 31st. You're going to count those 40 days and you're going to review up till May 10th. We're going to count 100 days after a surgical procedure for spinal fusion. So again, we do have a leap year, so don't assume that February has 28 days. We do have 29 days. And if you have a surgery that was performed on May 31st, you're going to review those cases up till July 9th of 2024. Next slide, please. So after you've reviewed all the records, you have all the ICD-9 procedure codes pulled, you're going to have the flag codes pulled with those ICD-9 codes in them. You're going to look for the overlap of those who meet the procedure codes and have the flag codes. These mean that billing or somehow in the record, it's showing signs of a post-operative infection. And those are the ones we want to capture and have a chart review of. Next slide. So with that, put all your information into REDCap, enter those flag procedures into the corresponding SSI validation form, and complete the applicable information, such as data surgery and others. For Colo SSI, you're going to use Form 4. For Fusion SSI, that's going to be recorded on Form 5. And review each entry, so looking into the patient's medical record to determine if the patient actually meets NHSN SSI reporting criteria. Next slide. So when completing Form 4 or Form 5, look at the columns that you have for these. If you have all this information entered and you're looking, is SSI met, yes or no, entered correctly, yes or no. If it was not reported, did it not meet criteria or was it missed? And then we're also going to be looking at ASA scores, and we're going to talk about that in a minute for those who don't perform that many colon or fusion surgery. So hang on to that thought. Okay, next slide. So your denominator data supplemental validation, or Form 6, is for those who are, say you're in a community hospital that doesn't do 20 surgeries of colon or fusions. So you'll need to complete the denominator data supplemental validation form. So using the list of procedures, randomly select up to 10 procedures. Then you're going to look up, record, and compare the NHSN data to the medical records data. So we're looking at ASA score, the duration of surgery, and wound class. And then we're going to look if they agree or not. So if the ASA score is perfect, it's in your record as a 3 and it's in NHSN and it's a 3, you're fine. If you have a duration, maybe it's just a couple minutes off, but if it's less than 10 minutes off, that's acceptable. But if it's more than 10 minutes, then there would be a little bit of data mismatch. And then with the wound class, and that's sometimes has a difference between what's recorded by the circulator and what's recorded by the surgeon. So look what was uploaded into NHSN as the wound class and see if the wound class actually agrees with the medical record. Next slide, please. So with this denominator data supplemental validation form, you're going to put in each of these procedures and you're going to select 10 of these procedures. So across the two procedure types, you'll select 10, maybe it's 5 colo, 5 fusion, or maybe it's 7 colo and 3 fusion, whatever to make it 10 procedures. Then you're going to record the ASA score as reported into NHSN, the ASA score from the medical record review, and check if they agree. Same with duration. You want to see if the duration was reported to NHSN the same as it was recorded, and if they agree, which would be less than 10 minutes. And then if there's a wound class, what was recorded into NHSN and what it was recorded from the medical record, and check only if they agree. If they don't agree, don't check them. Next slide. And I'll pass it back to Chris, who will go through our summary of findings.
Thanks, Maggie. Next slide, please. All right, so for our last section here, this is basically where we discuss the collating of the data as well as how to submit your findings. So you want to ensure that you keep those forms on hand because you're going to use those forms to populate the summary of findings section in the workbook. And so you're going to populate each row in its entirety to ensure data are reported for the correct event type. And then lastly, the calculations, again, can be rounded to the nearest whole number. Next slide. All right, so I'm going to kind of just walk you through each of these worksheets. So this is the summary worksheet specifically for CLABSI as well as Lab ID data. And so for the first column there, column A, this is where you will put the number of missed events that were identified during the validation. And again, so that's going to be column A. The next is going to be column B, and this is where you will list the number of events correctly reported to NHSN prior to validation. So as we can see there from the example, there were 2 that were missed. And then the second box, column B, there were 16 that were correctly reported. And so column C, we have the 2 plus the 16 gives us a total of 18. So for your case finding percentage, you will take the 16 that were correctly reported, you divide that by 18, the total, you times it by 100, and you have a case finding percentage of 89%. And so lastly, that last column there, that's again where you will list how many of those events were accurately mapped in NHSN prior to the validation. And so again, you will use this worksheet for CLABSI, MRSA BSI, and lastly, CDI. Next slide, please. So now we're moving on to SSI. And so for SSI, column A, this is where you will put the number of flagged procedures reported correctly as an SSI event into NHSN prior to validation. So column A, and for example, we have 3. So for column B, this is where you will put the number of flagged procedures that did not meet NHSN criteria as an SSI event. And so for example, we have 5. And so for column C, the number of missed SSIs identified during validation, we have 1. And so for the next column there, total SSIs reviewed during validation that meet NHSN criteria. So we have the 3 that were reported prior to the validation. We have the 1 that we found that was missed, gives us a total of 4. So for the case finding percentage, it'll be 3 divided by 4, you times it by 100, and we have a case finding percentage of 75%. And so again, we are going to be reviewing the procedures for SSI Colo as well as SSI Fusion. Next slide, please. All right, and so this last one here, this is going to be for our surgical denominator data. And so the first box here, we have the number of procedures reviewed during the validation. So we have a total of 9. And then the number where the ASA score agreed, so we have 7. So for our ASA score percentage, so 7 divided by 9 times it by 100, we have 75%. So for our duration, the number where duration agreed, we have 8. 8 divided by 9 times it by 100, we have a percentage of 89%. And lastly, for wound class, we have a total of 5. So 5 divided by the total of 9 times it by 100%. And as you can see there, we had a percentage of 56%. And so again, we will use this surgical denominator data worksheet for colo, fusion, as well as for the supplemental form. Next slide, please. All right, and so lastly, once you've collated your data, you got all your numbers, you're gonna submit your data via the REDCap link listed here. Next slide. And that is everything there. So if you have any questions, comments regarding the validation process, feel free to reach out to us at the email listed there. And please note our next regional call webinar will be July 22nd. Thank you all.